mynews.studio.
Picture this: a young girl in a desert community, her eyelids painfully swollen from trachoma. Now she can look ahead to a future where blindness isn't inevitable. But who made that possible, and what still stands between us and preventing every case of trachoma-related blindness?
And today is February 16th, 2026. To get a sense of the scale, let's look back. In 2002, trachoma threatened 1.5 billion people.
It's an enormous number. And trachoma isn't just about discomfort. It causes eyelashes to turn inward, scraping the eye, and eventually leads to blindness that can't be reversed. The people most at risk? Living in places without clean water or basic toilets.
So, the big question: how did we manage to cut that risk by 94% in just over 2 decades?
The answer was the SAFE strategy. That stands for surgery for advanced cases, antibiotics, like azithromycin, donated in huge numbers, facial cleanliness through hygiene education, and environmental improvements such as better water and sanitation. Each piece targeted a different link in the transmission chain.
And those antibiotics, just to be clear, that wasn't a token gesture. Pfizer donated over 1 billion doses via the International Trachoma Initiative. That's pharmaceutical action on a global scale.
Absolutely. But just as important was the data. The Global Trachoma Mapping Project surveyed 2.6 million people in 29 countries. Then tropical data added another 13 million. That meant efforts could be targeted. No more blanket approaches.
So they could actually see, almost in real time, where infections were rising or falling?
Yes, exactly. Since 2012, someone's eyes have been checked every 25 seconds. That level of surveillance made a real difference. Countries like Egypt, Fiji, Gambia, Vietnam, they've all been certified trachoma-free. In total, 27 countries have reached that milestone. And now, every region that had trachoma has at least one country that's eliminated it.
Still, the numbers left are significant. As recently as November 2025, there were 97 million people who still needed interventions. That's a massive improvement from 1.5 billion, but it's not zero.
Right, and the hardest hit areas are also the hardest to reach. Remote, dry regions or places affected by conflict. Take Ethiopia. In 2022, it carried out nearly 3/4 of all trichiasis surgeries worldwide. That was an 87% jump from the previous year, even with COVID disruptions and antibiotic shortages.
Let's talk about funding. There's still a $300 million gap to finish the job. Why is that so difficult to close?
Donor fatigue plays a big role, and these last pockets are the most challenging and expensive to reach. As the numbers drop, each case actually costs more to address. But if we leave these hotspots, the disease could come back.
Could the SAFE approach work for other neglected diseases too?
It's already starting to. This kind of data-driven integrated approach is now a template for diseases like onchocerciasis. In Gambia, for instance, water, sanitation, and health partners work together. So it's about more than just eyes. It's about building systems.
But what about fairness? You mentioned earlier that women are nearly twice as likely to get trachoma, and they make up most of the surgeries.
That's right. Women are more exposed to kids who are the main carriers. Plus, in many communities, women don't get care unless it's brought to them. Closing these gaps means training local teams and making sure outreach is focused.
And the antibiotics. Why did the supply drop from over 64 million treatments in 2021 to just about 33 million in 2022?
There were global supply chain problems, lingering effects from COVID, and more demand for azithromycin elsewhere. It's a reminder, progress isn't guaranteed. Setbacks can happen.
Are there any promising new tools coming?
Researchers are working on rapid diagnostic tests and even vaccines, but for now, the main tools are frequent treatment rounds and constant monitoring, especially in areas where the disease lingers.
So, looking ahead, is eliminating trachoma by 2030 really possible?
It's achievable, but only if funding and focus continue. The progress so far shows what can happen with coordination. But it's not just about trachoma. It points to new possibilities for tackling other preventable diseases.
Restoring sight, saving resources, addressing inequality. Those are benefits that reach everyone.
And the lessons here go well beyond eye health. It shows that with solid public health, good data, and real partnership, the world can change.
That wraps it up for today. We began with a child's vision restored, and we end with a clearer path for public health worldwide.
Thanks for tuning in. This episode was brought to you by mynews.studio. Give it a try for free.